You might think that in the 21st century we would have more advanced and humane ways of helping people with mental disorders, but sadly, this is not the case. In some parts of the world, people with mental illness still face abuse, neglect, and torture in the name of treatment. One of the most common and controversial methods of treatment for mental health is electroconvulsive therapy, or ECT. This involves the passing of electric currents through the brain to induce seizures, which is supposed to relieve the symptoms of depression, bipolar, schizophrenia, and other conditions. ECT has been around since the 1930s and has been widely criticized for its side effects such as memory loss, brain damage, and even death. In some places, it is still done without consent, without proper equipment, and without any monitoring. Another method of treatment is still used in some countries, psychosurgery, or the surgical alteration of the brain to treat medical disorders. The most infamous example of this is the lobotomy, which involves cutting and scalping away parts of the frontal lobe. The part of the brain resembles personality, emotions, decision making. Lobotomies were popular in the mid 20th century and were performed on thousands of people, often without their consent or knowledge. The results were often disastrous, leaving patients with severe cognitive impairment, personality changes, and even death. Needles are sometimes used in the psych sector as a way of administering drugs such as antipsychotic sedatives or tranquilizers to patients who are agitated, violent, or uncooperative. The use of needles can also be inhumane, especially if they are used without the patient's consent, without proper medical supervision, or without the regard for the patient's dignity or comfort. Some of the problems associated with the inhumane use of needles in the psych sector are the risk of infection, injury, or overdose from unsterilized, reused, or improperly administered needles, the violation of the patient's anatomy, privacy, or human rights, especially if they are forced to receive injections against their will without adequate information. It has the potential for abuse, intimidation, or punishment by staff who use needles as a threat or a means of control over patients. The negative impacts on the patient's mental health, such as increased fear, anxiety, anger, or trauma, as well as reduced trust, self-esteem, or hope. The inhumane use of needles in the psych sector is a serious issue that needs to be addressed and prevented. According to the World Health Organization, the use of needles in mental health care should be minimized and only done when absolutely necessary, with the patient's informed consent and with respect for their rights and human well-being. Seclusion and restraints are primitive and horrible practices that violate the human rights and dignity of people with mental health issues. They are based on outdated models of care and treat people as objects rather than subjects. They cause physical and psychological harm to both patients and staff. They hinder recovery and healing. They are not evidence-based or effective interventions, and they should be replaced by more humane and respectful alternatives that promote choice, autonomy, and empowerment.